Hi everyone, my name is Jacob and my topic was incivility in nursing. Incivility is defined by the American Nurses Association as one or more rude, discourteous, or disrespectful actions that may or may not have a negative intent behind them. This is a widespread issue found across all areas of nursing practice. In a 2006 survey conducted by the American Association of Critical Care Nurses, 24.1% of respondents stated that they had been verbally abused by a peer. This issue is not only exclusive to nursing, it can be found in many other professions. This is shown in research in a January-February 2013 Harvard Business Review article, where the researchers found that 98% of respondents, including lawyers, architects, coaches, and physicians, reported experiencing uncivil behavior at work. The issue of incivility has continued to increase, and this has prompted the ANA to revise the Code of Ethics. The following is an excerpt taken from the revision of the Code of Ethics. Nurses are required to create an ethical environment and culture of civility and kindness, treating colleagues, co-workers, employees, students, and others with dignity and respect. The Joint Commission has implemented new standards requiring healthcare organizations to have mechanisms in place to deal with incivility. This issue not only affects licensed nurses, it also has an effect on student nurses. Bullying is another issue that is plaguing the nursing profession. It is defined by the ANA as repeated, unwanted, harmful actions intended to humiliate, offend, and cause distress in the recipient. It not only threatens nurses' safety, but also their sanity. It also affects patient safety, and it affects the reputation of the nursing profession. There is the saying, nurses eat their young, that a lot of young new nurses or also nursing students might hear. I felt this was a good time to share a personal anecdote that was relevant to this topic. On one of my clinical rotations, I was assigned to a nurse who had a reputation. That morning, I went in to check in with my patient that I was assigned to. I was just assigned with one patient that day. And when I first did my first check, she had her nasal cannula in. And I ran her vital signs and her oxygen was around the 98% level. When I went back, not too long after, she had taken it out and she was lying down. When I went to run the vital signs again, her oxygen had dropped to about 93%. I asked her why she had taken out her nasal cannula, and she told me that the doctor ordered her to do so. So I sat her up, nice and tall in her chair. I hung her arms out over the table, the bedside table, had her take deep breaths, and then I measured her oxygen saturation again. I could only get it up to about 94%, and so I felt it necessary to let my nurse know. When I went to talk to the nurse, she said some pretty nasty things and basically just shooed me off. I was lucky to have a plan B and I was able to communicate with my clinical instructor, but nurses might not always have that opportunity. This toxic attitude showed by the nurse not only affected me negatively, but it also affected the patient negatively. Research shows that 60% of new nurses leave their first position within 6 months due to some form of verbal abuse or harsh treatment from a colleague. Violence is another issue found in the workplace alongside incivility and bullying. It can be physical or verbal. They're both damaging. There are 4 types of violence nurses may face in the workplace. Criminal intent, where the perpetrator has no relationship with the victim and the violence is carried out in conjunction with the crime. Customer-client, the most common healthcare environment-based assault. The perpetrator is a member of the public with whom the nurse is interacting during the course of their regular duties. Worker-on-worker, commonly perceived as bullying. In these instances, the perpetrator and victim work together, though not necessarily in the same role or at the same level. And personal relationship. In these incidents, the victim has been targeted as a result of an existing exterior relationship with the perpetrator, with the violence taking place in the workplace. This is a short video that complements my previous slides. I suggest you search the title on YouTube and give it a watch. So what steps can us RNs take in solving this issue? We can use primary prevention, where we must be responsible for creating and promoting healthy interpersonal relationships with all of our team members. Secondary prevention, when experiencing incivility or bullying in the workplace, the RN can respond to perpetrator directly or seek guidance from support channels. And primary prevention, the RN can participate in the development of the workplace violence prevention program and participate in education associated with workplace violence prevention.